any sort of like formal thing.
Yeah,
We just start yapping.
we just start talking. Yeah, but I do. I want, and I definitely want y'all to get a hold of my lips because.
Yeah. Let's do it.
Because, you know, well, you all know this better than anybody. I mean, the older you get, you start losing volume everywhere. And I feel like my lips have just been disappearing.
Yeah, we can plump them back up.
Yeah.
Yeah.
And so how does, like, what do you, like, when people come in to want their lips, like, redone, do they, like, do most people go gradually? Like, especially, like, somebody with me, like, where I don't really have any lips.
It depends. If you don't really have anything to begin with, I would definitely say gradually. When we have younger patients come in that want that really blown out look, they try to push for a little bit more, but I think we really try to push towards being more natural. So really trying to keep it to half syringe, one syringe in a sitting. But
So would that be like half of it here, when you say one syringe in a sitting?
yeah, and sometimes it's like that. Sometimes if you have heavier bottom lip, smaller top lip, then we focus more of it on the top lip.
Right.
It just kind of depends on what you start with and where you want to end up, I guess. It's
like
really
art.
customizable.
Yeah, it's like you're just kind of making lips.
Yeah.
Yeah.
Are we on?
We're going. We're going.
We're
No,
just going.
we always
Yeah.
just start just
okay,
chit
well,
chatting.
I thought we were
Yeah.
just chitty chatting.
Yeah, no. Well, we are just chit chatting. So. Yeah.
I was going to ask, like, where'd the trend for going for a more natural, almost like super subtle look? Where'd that come from?
Honestly, I think that there's a saying that the best injectables are undetectable. And I think we like to live by that here. You know, I think there's been a past trend of injectors not knowing when to say no, and that can lead to overfilled patients. And so I think it's really important to have an injector that can say, like, this is not in your best interest. I care about what's in your best interest. I'm not here just to take your money and put something in your face to make you happy, you happy, but I truly care about what's in your best interest. So I think there's definitely a shift happening right now towards more natural looking procedures. So procedures that are utilizing less and less synthetic products, which I have nothing against synthetic products. Lord knows I have lots of, synthetic things in my face, but I think that there is a trend that people are moving more towards things like fat grafting instead of filler. Of course, you metabolize through filler. You can hold on to your own fat quite a bit longer. So I think the trends are really towards more treatments that are utilizing your own body to stimulate collagen, elastin, retain your own fat, put it in places where you like, instead of using things that are synthetic.
So is it just they want something natural, or is there something, because it is a natural thing from your own body,
It sounds
that
like it's
it's
more
going to
about the
rejuvenate
science of keeping it longer.
Yeah.
Definitely
Okay.
the science of keeping it longer. So fat grafting in particular really doesn't cost that much more than filler does, especially when you consider that filler is going to last you, anywhere from 6 months to a year, 18 months if you're really lucky. Some studies show that filler can last longer, but that's very unpredictable. So you have no way to promise a patient that it'll last you 5, 10, 12 years. In some studies where it's shown to still be evident after that period of time, there's no way to predict that in a patient. However, things like fat, even though about 50% of the fat that you will inject in various places will actually die, fat has to have a living, it has to be attached to a living cell in order to remain alive. And so if you are injecting, if you're injecting in a certain technique where you're laying kind of dolloped, then everything on the outside of that dollop is attached to living tissue or touching living tissue, and that will survive. Anything on the inside will actually die. So the rule of thumb is that about 50% of whatever fat you inject will go away. And so what we'll do typically is to overfill, and fat's very forgiving, your own fat in particular. So we'll tend to actually overfill on purpose specific areas like temples, lateral cheeks, medial cheeks. We'll tend to use that overfill, and then your body is very forgiving where half of it will essentially go away. And then the rest of it is pretty malleable.
Interesting.
So, but do you have to do like double the injections over time? If you're going to lose 50%, do you have to do double the work?
It's not really double the work. We just see it as more of we want to pull off more. So we'll have to obviously aspirate the fat from another part of your body. So we pull off more than we think that we'll need. You know, if we're anticipating to need, for example, let's say we're going to do a full face rejuvenation on a male, you know, and you want to put approximately 25 cc's. You know, we lose an average per decade of life 4 cc's of just bone. So along with bone, you've got fat pads shifting, you've got all kinds of various compartments in the face that are shifting and moving and falling down due to gravity. And so if you're trying to do a full face rejuvenation on, you know, let's say a 50-year-old male, you could easily put 25 cc's of fat in their face and give them a really nice restored look. If we want that 25 cc's to stay there, we need to plan on putting 50 cc's in there. So they're going to leave that day looking full, and that is part of the consultation process. Really important to talk to patients about. We're going to overfill you because we know that about 50% of that is going to die, actually.
How long does it take for it to actually die?
I would say probably a couple of weeks. We would probably do a follow-up about 4 weeks out from that, 2 to 4 weeks out from that, just to see how it's. But your body essentially has to flush it out through your liver.
Is that the same process too? Like if there's no dissolving of that though, right? As you would
you can dissolve fat.
So like if somebody, you know how we were talking about like we wanted to try to get this, which we'll talk about in a minute.
Sure, absolutely.
But dissolving things that maybe migrated somewhere else, is that the same? Even though it's not the same as filler, of artificial filler, the fat, would you dissolve it?
So
if somebody needs
the
it,
manner in which you do it
is different,
similar.
Okay.
The product that you use in order to accomplish it is different.
Interesting.
So for filler, we use hyaluronidase, which is just a medication that is used to dissolve hyaluronic acid. And then if we are looking to dissolve fat, we use things like PCDC, which is phosphodioxycholic acid. And also the trade or the brand name for that is Kybella. People most often know that as Kybella.
Yeah.
You can have it compounded. Kybella is very expensive. You can actually have that compounded in various formulations from various pharmacies. So it's a little bit cheaper for the patient, and cheaper for the provider as well. But then you can have it compatible or compounded into a stronger formula, so that way patients can get quicker results. Because Kybella, if you've ever had Kybella or any kind of fat dissolving injection, it is extremely uncomfortable. It's very tender, and you swell like a banshee. You swell just bullfrog, especially if we're working on like submental area. You'll swell and look like a bullfrog for a good bit. So
so Jana, you know so much about all this stuff. Let's back up a little bit and tell us about your background too.
Okay.
And Miss Hannah, I mean, you're like, what you're doing, what you've built is just really impressive, and it's been pretty quick.
Yeah, it has been quick. My background is anesthesia, so I went to University of Cincinnati for my master's in anesthesia and graduated in 2013. So this is my 11th year as a CRNA. Awesome. I came back to Louisville. I grew up here for the most part. I was born in New Orleans, but grew up here. Came back to Louisville with my husband and was the chief of a local hospital, the anesthesia department of a local hospital here. I was working myself to absolute death. I was actually just talking about this a minute ago, but I was working myself to death. My husband and I have a blended family, so we have 4 kids combined. We wanted one together, and we couldn't get pregnant. I was working 80 to 100-hour weeks every week, but I loved it. I loved what I did, but it came at the expense of my family, and I couldn't do that any longer. And we couldn't get pregnant, and so I left the OR, and that was really hard for me because I loved what I did. But we got pregnant after a month.
Oh my gosh.
That I left.
Well, that is not telling. I don't know what it is.
I know. Stress plays a big part. And I started doing ancillary anesthesia around town, and that's wonderful. I still do that. I have a wonderful boss who has been, Lord knows, just so good to me over the years since I've been gone from doing, in the OR. So I do ancillary anesthesia around town still to maintain my license, but that really doesn't fill my bucket, and it hasn't. I've always just kind of had this need to contribute in a way, and so I just needed something. Sorry, Hannah, just pulled your hair out. I felt a need to do something greater and bigger and engage myself more.
Yeah.
And so I went and got trained in aesthetics, and Louisville Lush started. That's how it originally started. We did a brand change about halfway through Louisville Lush's existence to XO Aesthetic Refinery, and we're now federally trademarked, which is super cool to get that fancy little R after our name.
Very cool. Congratulations.
And it's just grown by leaps and bounds. Hannah was our first ever hire. So was Lauren. And along with, Emily, who's still here as well. And then it's just grown over the years. We've gone from being in a little tiny salon and a hair salon, a booth in a hair salon, to having this great place here that we're actively outgrowing.
Yeah, it's awesome.
As well too. And it's a lot of fun. It's just a really, really good, I know I say it every day of my life, but it's just a really good group of people.
It is, and you do. Together. And Hannah, what is your background?
So my background is I'm a family nurse practitioner. So typically, well, really you can go lots of routes with that, but oftentimes primary care is the most common. So I was doing more pediatrics in the west end of Louisville at a couple schools down there. So it's basically like a little clinic, more or less, inside of the schools, to keep the kids from missing school. Yeah, if they were sick, I could see them, send them on their way.
Picking that up on the camera. Jen's hungry.
So I did that for some time, and then, before that, as a nurse, I worked in labor and delivery and ICU and all of those, fun things.
Yeah.
But so then, I guess fast forward a little bit, I saw Jana for some Botox because your girl had a huge wrinkle. I went on like a beach vacation. I came back and I was like trying to clean my face, and I realized it was a tan line from squinting in the sun so hard right here that anyways. So it's like something needs to be done here. So that's how I met Jana, and then I heard about the job interviews and then came to this, and it's been amazing.
Yeah,
Jana is
awesome.
Such a hard worker and really easy to work for because she is a go-getter. So
And what year
she
did
gets
you
things
start?
done.
2021.
Yeah.
Okay.
2021.
October of 21. So we started in March, originally opened in March of 21, grew very quickly. So by summer we needed like a physical space. We were just working out of, our homes at that point in the very beginning. And we decided to do something a little bit different. And I say we, meaning my original business partner and I, in that we just held open interviews, and we were looking for, there's so many nurses that wanted to get into aesthetics and didn't know how. It's a really common thing that we hear. People just don't know how. And so instead of asking to hire people that had experience in aesthetics, we asked for people that maybe didn't have experience in aesthetics. And then we weren't that far out of our training as well. So not only were they able to learn from us, but we were also able to learn together as we grew together. And so, I mean, Hannah and I were just saying the other day, the difference in our experience is really not, relatively speaking, is really not that much. I mean, maybe 6 months apart from each other that I was training before we brought her on. And I remember how nervous Hannah was when she first started injecting, just absolutely, I mean, anybody is, when they first start injecting, just absolutely terrified. But, and it's just so fun to watch everybody, their confidence has just grown so much. I mean, and again, it's just a really great group. We've got lots of different backgrounds, lots of different areas of expertise. And I feel like we all just complement each other in such a great way. We're advocating for each other. We're supporting one another. If there's something that someone wants that is not my forte, I send them over to Hannah or vice versa, or to another provider. There's no competition. It's all positivity. It's all love here. We're truly just here. And if we can't give you what you're looking for, we have no problem sending you to some place that can.
That's
know,
good,
we just
yeah.
want to make people feel the best version of themselves. That they
And I think
possibly
it's
can.
important because there are a lot of aesthetic salons now, or whatever you want to call them, not salons,
Yeah,
but
sure, spas.
practices. And I think it's important. Like all of you seem, maybe not every single person here, but majority of you guys all have a medical background, which I think is a really big differentiator. I think it really makes them, maybe people that are new to injectables and all the other procedures a little more comfortable. And I think that that's important because there's so much more to it than just injecting. Like there really is. And I think when it all started a long time ago, nobody really thought of it that way. And I think that now it's so important to know, you know, your history of like your expertise and what you guys do.
When we first started, all of us, we all had other jobs. This is what we did for fun, truly. We worked, I mean, Hannah would come after she was at school. She would come to the office, and even if she wasn't injecting, she would just come and learn and watch consultation processes, talk about muscle anatomy, just engage with patients. And there's so much of it that happens on your own time, you know, watching Patreon videos and studying anatomy and reading textbooks. And there's so much that happens on your own, but we all, in the very beginning, had other careers.
Right.
I mean, I still do anesthesia
Yeah,
one day a
right.
week, you know. I'm able to do some anesthesia here now, which is really cool. And I love being here. Hannah's here full time. That was really exciting when she took the plunge, and that was very much a leap of faith on her part, but she took the plunge and left her full-time job to come here
Wow,
full time.
yeah.
And, you know, we have Jess, who's a neurosurgical nurse practitioner. She's still in the OR down at U of L doing brain surgeries all during the week, and she's here on Fridays and
Wow.
Saturdays. You know, Emily is an educator at Sullivan, so she teaches in the nursing program over there. So and Lauren, who was here just a moment ago, she's in the PACU. She works in recovery in Norton Women and Children. So a lot of us still maintain a lot of our outside skills, and honestly, some of the skills that Hannah and I did have outside of the spa are now translating to things that we're doing in here. Hannah's
Well, that's what I was
seeing
just gonna
patients
say, yeah.
for weight loss. So there are some wellness visits that Hannah, so I mean, she's able to do that because of her experience and her background, you know, outside of here.
Such a differentiator, I feel like. For,
Yeah, it's really
gosh,
cool.
I'm so sorry.
That's
We have a
impressive.
fourth interview.
Honestly, I'm
Do you have any
impressed.
food here for Jen?
I'm impressed.
I'm really not that hungry. Maybe you can explain this to me with your medical background.
That's
Why is
called
my stomach keep
warming
growing and I
me.
really am not that hungry?
Would you like some popcorn?
We have popcorn.
Okay.
Right? It should be. You know, I would think that maybe at some point it gets or the appearance of being distracting of, oh, you're doing this other job and then you come in here and you have a lot of people doing that. Why is that a benefit in your opinion? Because of what you just said, the skill sets that you're able to bring in,
Honestly,
the continued learning and other
yeah,
things.
Yeah.
I think if you try to put yourself in the position, I mean, at least I hope that this is the case, and it certainly wasn't necessarily our intention going into it this way, but it's kind of funny how it worked out because I love this about us. But if you think of it and you're looking at from an outsider's perspective, you've got a list of practitioners that are lined up in front of you. You have a history, you have a background, you know what, you know, if they're still working, how many hours, you know, you have all of these credentials in this timeline of their education. And you see that you've got someone who is a specialist in neurosurgery and migraine therapy, and you can get your Botox from them, and you suffer from TMJ and migraines.
Absolutely.
That's what I would choose. So
And that's kind of what I meant about like
Yeah.
the experience that's here and the knowledge far exceeds just injectables.
Right.
yeah, most definitely. And you know, it's not uncommon that, I mean, we had a patient last year that was here, and she wanted to start talking about some weight loss injections, but we did some labs on her, and she had some interesting labs, and she actually ended up having cancer. So there are our education goes way beyond
Right.
injectables.
Right. Which I
Of
think,
course,
like I
that's
said,
not a
is
fun-
important.
Yeah,
very
that's not a
important.
fun, that's not, we did not diagnose her with cancer, but we said, hey, you need to follow up with someone on some of these things. And so, but, you know, my background is anesthesia, and Hannah's background is family medicine and peds. That is not my forte, you know, so it's just, we come together, and it's nice because Hannah and I end up actually working together quite a bit, and our skill sets really complement each other.
Well, I think it's like taking care of the patient, the whole, you know, it's like, because you all are able to, like you said, you're checking on things and not just coming in and just, you know, you're making sure that all these things are actually good for different people, because some things might not be appropriate for some people.
You were
You know.
joking yesterday. I was practicing doing my labor and delivery breathing with the patient.
She we had a patient that had some anesthesia for a more invasive procedure, and she was not doing very well under anesthesia, so we had to wake her up.
Wow.
And Hannah had to do some deep breathing with her, and I'm like, I see this labor and delivery nurse coming back. I'm loving this look on you. This is great. We were actually doing some liposuction of her inner and outer thighs, and so we had to get her knee up on the shoulder, and I'm like, Hannah, I feel like this is what it would have been like if I would have been my labor and delivery nurse. I just see you. You're so good.
So how do you communicate that differentiator to people so that they understand that you have those backgrounds?
Yeah, I think I hear a lot that we don't communicate it enough, and I don't quite know. I guess I struggle between what's the line between trying to take your skill sets and use them to your advantage and gloating, right? Like, hey, look, we're all, I think one time we calculated all of our years of experience, and to combine we had like 88 years of experience in healthcare, ranging from critical care ICU to neurosurgery to family practice to pediatrics to anesthesia to, just all the way across the board. So, so how do you convey that? I've been told multiple times, hey, you need to blast your all's education. That's what sets you apart from any other med spa in Louisville is your education, how much time you spend in consultations with your patients, your integrity, your honesty, the warmth that people feel when they come in the door. It's hard to, that's not my background. So advertising and marketing myself is not my background. I have no idea how to do that. I know, this is fun. This is fun.
Good place to start.
But see, I would think that if you just tell how it translates into being here, the story that you just told, like literally just that.
Yeah.
Because if you say like critical care or emergency room, like what happens in a med spa that's going to be important? You know what I mean?
You'd be surprised.
So,
So-
I'm gonna end up in the
You'd be surprised.
But if you could just tell those stories, I would think that would be great.
Yeah, we just started doing like a welcome packet for. I just pulled your hair down. I'm really sorry. We just started doing. I use my hands too much when I talk. We just started doing like a welcome packet for patients that are new patients that are coming in the door. And so there's a little bit of a letter from me and then there's a bio on a few of us in there as well. And so I think that's kind of like an initial step. But again, I don't know.
I think what's wrong with posting about it though?
I don't
why?
know.
I feel like, and that's that whole thing that people are like, we're afraid to like give ourselves our own pat on the back kind of thing.
Yeah.
But it is truly what sets you apart.
Thank you.
100%.
But it's a benefit too, right?
And right, absolutely.
I mean, it's no different than saying that you have a certain tool or resource here that
The best
your
laser
clients benefit
or-
from.
yeah.
I mean, the letters behind your name matter. So.
I appreciate that. That means a lot. I like, we've just, because we started doing anesthesia in the office now, we have a crash cart here, things that you hope you never, ever need.
Really?
Yeah, absolutely.
I guess you have to.
Yeah,
that makes sense. I didn't even think about that.
I wouldn't give anybody anesthesia if I didn't have medications in the event of an awful reaction. Hopefully that never happens. Since I've been doing office-based anesthesia, I've had it happen twice in 7 years, and it's terrifying, and I hope that never happens here. But if I'm missing something, I'll sure as heck need it,
Right.
when something happens. So, we have an AED, we have 2 AEDs because I accidentally ordered 2. We have AEDs, we have crash cart, I can intubate someone if I have to.
And have you trained others on the AEDs and how to use them?
Oh
and
yeah,
that sort of thing, right?
We all are ACLS, but
Okay, cool.
we don't advertise that, but we're all ACLS certified, BLS certified, and
Do you feel like that makes you look overqualified? I'm wondering if there's an element of that where you're like,
Maybe.
well,
I think when you've seen a lot of emergencies or issues in your career, you just want to prepare for anything that could happen and not be caught, empty-handed.
And I guess from a marketing standpoint, maybe you're worried that it makes people nervous.
Yeah.
sure.
So you
why
maybe
would I
don't.
wanna
It's
address
kind
it
of a
like
fine
that?
line of how much of this
A
do
we have
we-
emergency. Yeah,
How
we got
much of this
AEDs.
do
We got all
we-
this stuff. You're
Yeah.
not going to die
Why?
here.
Yeah.
Wait, what are you talking about?
Why would I?
I thought
Yeah,
we
I
were just
was
talking
coming in-
Botox.
Yeah.
All right.
But I would also like if you go to Biscuit Belly around the corner, I hope they have an AED. You know what I'm saying?
Right.
Like,
Yeah.
and the realism of it is most places probably don't have those things, but
Right.
we are all medical here, and actually the girls have been asking for an AED for a long time, and now I have 2, so they are doubly happy. But those things are ingrained in us to reach for in emergent situations. It's truly impressive, Jen. But
We're laughing at. Yeah, I know.
it's very impressive.
It's just going to keep getting.
I really hope it's on camera.
I have like a different question because CRNA, right?
Yes.
Isn't there a thing between some weird battle between CRNAs and
And
anesthesiologists, and
I think
you have to be like babysat or like
in
something
Kentucky.
like okay.
Kentucky is
She said not in
actually
Kentucky.
a shock. I know this is my platform here. Kentucky is actually a shockingly progressive state in terms of that. So CRNAs actually work completely independently here.
Okay.
We're one of 17 states in the U.S. As of the last time I checked, 17 states that operate independently.
Is this new, or is that
It is not.
has
it's
it always
not
been that way?
new.
Okay.
Ever since I've been out of school, so 11 years, it's been that we've operated independently. And I don't think it was too long before that the law was changed.
Got
Now, the standard model in anesthesia is that CRNAs are typically in the operating room, and then you've got docs that are kind of out there covering. It's no different from Hannah and Jess or Lauren injecting in these rooms, and I'm just here if they need me to help get, you know what I'm saying? It's
Yeah.
a very similar model. It's like the more hands, the better if something happens,
I
right?
had somebody that was running for like the national board of something for CRNAs one time, and so that's how I
Oh,
know
yeah.
a tiny bit of this,
Yeah.
because they were asking for
Yeah,
advice on
so,
how to do this.
You know, there's a nurse was the first person to ever do anesthesia ever back a long time ago. I'm not going to get into a history lesson about anesthesia, but nurses were the first to ever do anesthesia. I have worked, some of my best friends are anesthesiologists. I've worked very closely with them. I've worked with some that are extremely respective of CRNAs. And have requested me to do anesthesia for their loved ones, you know, over, you know, an anesthesiologist, and vice versa. You find bad apples in every profession out there. I mean, there's bad injectors, there's bad CRNAs, there's bad anesthesiologists. But, you know, I would say that by and large, that stigma of there being like a fight between the two is
You don't feel it around here.
not so much.
Do you feel like, is there still a need for a difference, or do we start to favor CRNAs?
I was just going to ask that. Like, what is the
like, what's the point
difference?
if you could both kind of do the same thing?
Yeah,
I don't know the nuances.
I'm going to offend the anesthesiologists on, I mean, we get paid less, essentially. A lot of times anesthesiologists end up taking more call. Now CRNAs are starting to take more and more call,
But what don't you know that they do?
we go through our training pathways are different. So like you have to do a certain number of years in critical care after you get your nursing degree. So I went to trauma ICU, and then I went to ER before I went to anesthesia school, and then you have to pass several certifications, and anesthesia school in and of itself is about 3 years. So in all, you've got about 9 to 10 years of training as a nurse anesthetist. There's been a trend of moving away from the terminology nurse anesthetist towards nurse anesthesiologist, because anesthesiologist just means the study of anesthesia, that you have studied anesthesia. And I think that's in an attempt to try to bridge some kind of, you know, invisible gap or ego gap. I truly don't care either way. I'm proud of what I do, and I enjoy what I do, and I love that I get to do it here now too. I kind of get to have the best of both worlds here, but yeah, I mean, I can think of a particular anesthesiologist that I worked with we had a case that came in, and it was kind of all hands on deck when I was over when I was the chief over at that hospital, and I had every available anesthesia provider in the room, and we for sure thought that patient was going to die when they came in the door, and he had the most brilliant idea, and I went and told the family after that patient survived that surgery and said, your loved one would not be here if it wasn't for that particular doctor being in that room. It was absolutely brilliant what he thought of it. In a million years I never would have thought. So I mean, I think hopefully we work in ways that complement, you know, each other, and you know, I'm
just here to support one another.
I just want everybody to get along.
But
Well,
with
seeing
the-
that, go ahead.
You go.
Go ahead. No, it's
I was going to say, with the nursing background, there's a little bit more bedside manner and other components to it that somebody else might not have. So I'm sure that's useful.
Yeah, that's definitely what nurse anesthetists are really proud of, is that we have been we have done more work on the bedside typically before anesthesiologists get to the bedside, and so I think it's expected a lot of times that we have a better bedside approach. I mean, I was taught in anesthesia school. One of the first things I was taught was you have 5 minutes to make an impression on someone before they trust their life in your hands. And that's not ever something to take for granted. And I've never forgotten it since that day. Even here, you know, we oftentimes have a very little bit amount of time to make an impression on someone before they've made their decision on whether or not they want to choose us as their provider.
So how do you do that? How do you make an impression?
Honestly, I think listening is the biggest component of what we do. And I think that's where a lot of other places can go wrong. You know, sometimes people are treated like cattle being herded through various aesthetic places, and we take a lot of time here in our consultation process. We get to know you. Are you working towards an event that's really important to you? Are we working on an area that doesn't need to be worked on and there's something behind that? Is there's some self-esteem issues that we need, you know, to talk about and address? You know, it becomes therapy, honestly, and these
Totally.
a lot
Yeah.
of the time, truly.
So the ethical part, or maybe that's the right way to put it. I don't know. But like somebody comes in and they say, I want to do this thing. And you're like, wait. This is either dangerous or is this really going to be the fix that you think it's going to be?
Right. We've had to have those
you have those conversations?
Absolutely.
Yeah.
Recently.
Okay.
Yeah.
Yeah.
I've had those conversations recently, and I know Hannah has too. And there are a lot of times those conversations are really, really hard, and we'll confer with each other, or we'll pull another provider in there to have those conversations together. Those conversations can be hard, but we're not in the business of taking anybody's money if it's not going to make them feel better about themselves. And, you know, I know that there have been providers in the past and patients have come in and said they want X, Y, and Z. They don't need it. And so the provider just injects saline and charges them. And that's completely unethical in my opinion. But it's, the patient has this psychological need to have this procedure done. But we're not addressing the root of what's going on there.
Right.
And we are not trained therapists by any stretch of the means, but we can say, like, hey, this is deeper than what we can do for you here. Let's talk about this. Let me see if, you know, can I refer you someplace? Here are things that we can do. I mean, various things like that. But yeah, there is an ethical component to it.
I do think it happens less and less, though, with what you said about like going towards natural trends, or the trends going towards more natural. I think a lot of that has to do with, I feel like there's more of a push towards like self-love and like accepting what you look like or how you are, versus trying to change that. So I feel like we try to focus more on, like enhancements versus like full transformations or like fully changing how you look. But like, and then, you know, with social media, obviously there's a lot of comparison and things like that. So I do think it's hard for people, you know, to not do that. It's hard for me to not do that. But I think that's what we focus a lot of time in consultations on, is like what's actually bothering you, or things like, you know, more things like that versus like, can you make me look like Kim Kardashian? You know, things like that.
Yeah.
So
yeah, I think it's a really interesting. I'm
yeah.
sorry, go ahead.
No, I
Keep
just
going.
think that's part of it. And even like the Kardashians are getting all their stuff dissolved. So like, you know, I think that's a huge influence on what women think is, you know, desired or acceptable or pretty or things like that, is based on what celebrities are doing.
It's true. I mean, it's very influential. I mean, you know, and were you gonna say something?
No, I was just gonna say, I think it's interesting how people define self-love, because that could be just so different.
Yeah.
Where some people are just 100% natural, like, no, this is just me.
Right.
Where somebody else is like, I'm gonna get something done because it makes me feel good, even though my partner or some other people that might judge me traditionally, I don't really care, because this makes me feel good.
Yeah.
We get that a lot, and you know, people will sit down in our chair daily and say, well, what do you think I need done? And our first response is, we're not here to pick you apart. You know, we're not here to judge. We're not here to say you need X, Y, and Z done. We are truly here to make you feel like your best version of yourself. So if you want to talk about what bothers you, let's talk about what bothers you, and the ways that we can help correct that. But we aren't here to pick anybody apart. We think that you're beautiful how you are, and we just want to make you feel the best way that you can. So yeah, I think self-love can mean a lot of different things. It can mean loving yourself as you are. It can mean doing things for yourself to make you feel the best version of yourself that you can be too. I think it can be any version of that. We're all for self-love in whatever capacity that means for the patient.
Are you seeing, and I know you are, because we kind of talked about this before, but like there's so much more men that are more comfortable like with all these procedures because it was so female driven, and it was just, if men were doing it, they didn't talk about it, or they weren't, and I just feel like it's okay for men to be like, you know what, yeah, I kind of want to dabble in this, all of these different treatments. Are you seeing that a lot too?
We're really passionate about removing the stigma from male self-care. I think traditionally male self-care has been something that's not, like you said, just really not discussed. It's expected that male self-care is, working out,
Right.
working hard, those kinds of things. And we are seeing more and more men come in and start to dabble in things like just skincare, and that's totally okay.
Right.
Then you have some men that are like, I'd really like to do something about these wrinkles, or is there something we can do to help decrease some of the hair loss that I'm experiencing? Or I've got some sunspots that really bother me, or this scar, or, hey, this double chin has driven me crazy for years and I hide it with a beard. Can we work on that? So that's a huge component
Right.
of male self-care too. And so we love having the opportunity to take that stigma away
Yeah.
from men. My husband gets regular routine treatments, and he is thankful that he's, now has a wife that can do those things for him. But he's like, I can't believe I didn't do this for myself
Right.
sooner.
Yeah, and I feel sorry for you men, because you feel like
It's hard.
you're not supposed to
hard.
allow yourselves to do the same things that we do. It's like, oh, I don't need that, but it's like, well, what if you do? What if you
Yeah.
want it?
I
Like,
think
it's
it's awesome.
okay. And
What
so
are
I
some
feel
of the
like
things that are
yeah.
getting done right now?
Yeah, for
Like
males.
like an entry point, if you will.
I think entry point is always a facial. I mean, a facial is a really great way in order to look at pigment, look at skin tone and texture underneath a microscope, to make you feel really nice and hydrated. Talk about what products you're using at home, making sure you're taking good care of your skin, using sunscreen, all of those good things. That's usually a good entry point into doing a little bit of Botox for men. A lot of times men are coming in because they are starting to see some receding hairlines or a little bit of hair loss. And they want to see what they can do to prevent it. And there are different ways that we can do that as well. Vitamins, injections, things like that. And then, we do see a decent amount of patients for issues, with self-confidence regarding to erectile dysfunction. There are some things that we can do there as well, whether that is size related or actual, like physical related, ED that happens as we age. There are things that we can do for that as well. That is a harder thing to get men to come in the door for, to seek treatment for, especially, a lot of times the first step is talking to their primary care provider about it. And a lot of times that goes a long time before they start speaking up about it. But there are lots of things that we can do in the office in order to help with those things as well.
Yeah.
What do you think is going to help expand these conversations and make it just more, I don't know, what's the word I'm looking for?
Comfortable?
Yeah.
Just destigmatize it a little bit. I don't know,
Yeah.
what do you think?
Yeah.
I mean, is it just seeing other people on social media?
I
Is
was
it
just
going
gonna
to just
say
take that?
that's the first part. I think
Other
that's
people
what's
that
helped.
look like you that are out there and talking about it and sort of taking
I
that
think
stigma
so.
away?
I think so.
Or like we could take you in there and give you some Botox and film it and be
yeah.
like, hey, look, Brandon today's getting some Botox. And they'll be like, Brandon did it, I can do it.
I definitely think it's a lot of that.
But I mean,
yeah.
it is.
Yeah.
It's like, oh wow, cool. Like it's no different than, women. Like if you've been hesitant to do something and then you see somebody maybe on social media or a patient that you agrees to go live on Instagram or something, they're like, oh hey, okay, maybe I'll try it. I know her, and I know she was worried about it, but she did it. I think it's the same thing for men. I mean, don't you? What if you saw like a
I
friend?
would think so. But I
like-
mean, it just seems like such a big barrier right now.
I know. Yeah, I don't know. What, like, if you wanted to try something, what would be the hesitation? Oh, I have stumped Brandon.
No.
I
So,
think they
but
don't
I
know
would
where to
say
start. I
like
think
immediately what comes to mind is
Yeah.
not the judgment of somebody else. So I was trying to
Right,
think like
yeah.
what was the first thing I thought of, and it was not like somebody else. I don't know. Maybe part of
The dog
is that
eating
lunch
your
over
lunch.
there? That's funny. I don't know. I would think part of it is just maybe not knowing what it looks like.
Yeah.
Now I've been in the room with you,
Yes.
seeing you get
filmed
things
me,
done,
yeah.
so it
Yeah.
looked, manageable and like not crazy.
I didn't
you know what
cry. I
mean?
didn't flinch.
I know.
Didn't pass out. That's good.
And you didn't pass
Yeah.
out. That's
I think
true.
for men, it's the same for. That's water. Okay, it's water. We're good. I think for men, it's the same as for a lot of women. You just don't know where to start. It
Yeah.
feels
Mm-hmm.
overwhelming. The idea of where do I start in this massive aesthetic industry that brings in billions of dollars for
Right.
the U.S. every year. Where do I even start? And just not knowing where to start.
Well, and I think, like you said, like, I think that's no different than when I first got Botox. I think it's like, what am I going to look like? Like, and I think, and I've heard that from some of my guy friends. They're like, well, I want to get it here, or I want to do this, but am I going to look weird? And I'm like, well, you're just not going to have that wrinkle, so you're not going to look weird.
I do think that sometimes, I'll say sometimes you see like an older celebrity, for example, that you haven't seen in a while, and now they're on TV, and you're like,
Whoa.
what happened?
Yeah.
And it's
doesn't
like,
help.
it's been 15 years, and you look like you tried to subtract 30, but I'm not sure what's happening here.
Yeah.
And it
Well,
just,
you wouldn't
it's-
go to that extreme.
but
But I see, but you
if that's
worried.
your reference,
Right.
Yeah.
That's true.
that's your reference. You
a
know
good
what I
point.
mean?
A lot of people think that can happen in one sitting too. Like, just your first appointment, you're going to look puffy and, pillow faced or whatever. And that requires a lot of product. That would be
Right.
lots
A lot of
money.
time.
Yeah, and I think
That
that's
is
what a lot of men
overtime.
maybe don't necessarily understand is like it's an overtime process.
Right,
Like just
right.
one Botox treatment, you won't
Right.
look. I'm
But
trying to
with
think of
that,
who's
with
the
what you
most-
just said, it's like,
Yeah.
okay, but if I start, does that mean over time I'm going to get that result?
Right.
You know what I mean?
Right. Yeah. I think that's where having an injector that can tell you no comes into play. So-
Yeah.
Sorry. I think so.
Frankie's trying to eat their lunch. But I think you're right. Yeah.
Yeah, having someone that can tell you no. Or
Yeah.
I always tell people to like keep old pictures of yourself to like keep yourself in check because I have become victim to the lip filler situation. So like my lips were never small to begin with, but I have just gradually, gotten a little bit here, a little bit there. And the other day I was like, my lips are much bigger than they were when I first started working
You're like,
here.
okay.
Yeah, so I was like, okay, so maybe I need to hold off on this year's injection. Just keep.
That's actually a really good idea.
Yeah.
To like, hey, remember where you started.
Yeah, and
And
you
kind
don't
of
wanna look
keep
totally
keep
different.
reminding yourself of
I was
that.
going to say
Yeah,
that
that's a good
baseline seems
idea.
like it
Right.
changes over time. You get used to this is how I
Yeah.
look now.
Exactly.
Yes.
Yes.
Yeah.
It changes.
Yeah.
So, I think
Well, and that's like with Botox, like, and I mean, it truly is preventative, right? Like, and I was going to ask you about that too in a sec, but because of that, like, you just, like, okay, this is how it makes me look, and I want to continue to look that way. And then, but there are times when you can be like, oh wow,
Yeah.
whoops, but a little too much.
Too much.
But how young? So that was the two questions I was going to ask. Was like men starting to come in more, and hopefully, back to barriers, like breaking down those barriers and making them feel comfortable, that bedside manner, and getting them in the door. But also age, like how I feel like so many girls and guys too anymore now are so young. Are you seeing people that come in that really don't need anything done at all,
Yeah.
but they are so convinced?
Yeah.
And that's got to be hard because it's like,
Well, it is hard.
but we could say nobody needs anything done at all.
Of course, yeah. And so again, I think a lot of it is getting to the root of what
Yeah,
they
that's-
think
yeah.
that they need, right? Starting tox young truly is preventative,
Yes.
and that's where you
I
can call
totally
it baby
agree with
Botox.
that.
So you can dilute it, you can just kind of spread it really, really nice, and then you can keep it to a really low dose. Frankie,
I love his name, by the way, Franklin.
Franklin, sir.
He's like, what?
It is. Yeah.
What's going on?
And so we can do baby Botox to start doing preventive. If people are aware, like I understand I don't have wrinkles, I just don't want them to form. I have a little bit of money. I'd like to just kind of start some preventative Botox. Okay, that's a perfectly normal, very rational conversation. We have had phone calls from people that say, I have $200 and I want to look like Megan Fox. And that's just, it's not realistic. So we're not
Right.
dealing with realistic expectations. That's
Right.
a huge red flag, right? We're not going to be able to deliver
Right.
at all on what this patient wants. And we need to have an honest conversation.
Well, and that's
about
what's so good about what you said is that you
expectations.
sit and you talk with clients, and those consultations are so important. That you're not just okay, yeah, come in, we'll make you look that way.
Yeah.
And those just doing it to do it kind of
So
thing.
here's a question from somebody that doesn't know. So if you start young, is it a once you start you shouldn't stop kind of situation?
Not necessarily.
Okay.
No, I think just if you stop, your lines will just kind of come back, but you don't look weird. Or a lot of people say that, like, what if I try this one time and I hate it? That's okay. You don't have to do it.
Yeah.
Your muscles will just continue to work how they would have if you never got treated, and the lines would just form back.
Well, and
Like-
I mean, as a patient, I had a wrinkle here, and I don't ever have that wrinkle. That's what made me start back in my 20s, late 20s. I had this wrinkle right here, like you were talking about this one.
Yeah,
You had right
right
here.
here.
I had one right here, and it was from sun damage and all that stuff and whatever. And I mean, if you can't make a wrinkle, you can't keep a wrinkle. That's my mantra. And it's never come back. Now, there are times like different wrinkles have started over the years, but not that one, you know. And then talk a little bit about atrophy, because I know what that means, but that is truly something, because that's why I haven't needed as much, and that wrinkle hasn't come back, but I do get new ones.
Yeah, that is something I was going to say a minute ago. Atrophy is very, look, Lauren sees that Frankie's getting in the food. Oh, she just casually walked away. Atrophy is very real. So it's very much like a workout. You use muscles and they work up and they build up and you get wrinkles, right? Or you build muscle. If you can't use that muscle for whatever reason, whether it's Botox, whether it's because you're wheelchair bound and you don't have any muscle tone or movement in various limbs, you actually atrophy. Those muscles atrophy because they're not being used. And so it causes the muscles to actually, we don't want to say shrink, but atrophy. And so people will find, particularly in bulky muscles like the masseter, we're not necessarily doing masseter injections for cosmetic purposes. A lot of times it's for therapeutic purposes, because patients grind their teeth. They have migraines. They have to wear bite guards at night. They have pain in their jaw at the end of the night, which is what Hannah and I both have when we're stressed. And so I'm not doing that for the purpose of slimming my face. It's a really nice secondary benefit.
Right.
But if you are constantly grinding, you can spot a person that has migraines from their masseters a mile away. They have an extremely square jaw. And actually, one of the radio hosts here in town is very open about her masseter treatments here, and I saw her coming in the door, and I was,
You're like, I know what you're here for.
Yeah, well, but
Are you looking at me right
now? She was not here for anything. We were just discussing that day, but I just said, I have to ask, do you have bad headaches? And she was like, yes. And so I was able to say, are they here? That's because your masseter muscle is connected to your temporalis muscle. And so I said, are they here? Do you find that your jaw's sore at the end of the day? And she was like, did I just walk into a psychic shop? And it's and one side is usually worse than the other. But so we inject those masseters routinely, and then they atrophy over time. So even when the tox is fully worn off, it's not like they come back as huge and puffy as they were before. Now, over time, of course, if you don't get it, it'll continue to build muscle again, just like you're continuing to work that muscle, work it out. But if you maintain those muscles will stay nice and atrophied, and you may find that you need less. Now, different neurotoxins have different preservatives in them, and sometimes you can find that you build a resistance to the preservatives over time, actually causing you to require more of that particular product. But by and large, if you're maintaining routine neurotoxin every 3 to 4 months, you should find that your dose remains relatively constant. Over time.
Yeah. I mean, and that's totally what has happened to me. I mean, and you guys, like, what is some of your favorite things to do? Because there's got to be something that you feel like you're your best at, or like when somebody comes in, you're like, oh yay, yes, I want to do that. Like, what do you enjoy doing the most? Because there's a lot, but people don't realize. I mean, you all really are like, it's like an art. I mean, you really are redefining people's. I mean, you can add, like, y'all can do the non-surgical, nose jobs and all that stuff. So what's something that you?
I feel like mine has changed over time, but I feel like more recently it's either the face tight, or I really do enjoy cheek filler, because I feel like that's not 9 times out of 10 if I'm doing cheek filler, you do not sit down and ask for it. It's just that you pointed to something else that can be fixed with cheek filler, or at least made better with cheek filler, and it makes a huge difference. And again, it's not something somebody was expecting, so that's my favorite, seeing the reaction afterwards. I would say something like that, or now more recently is probably the face tight again, because of kind of a similar reason, is the transformation. And
is that the laser?
It's actually our newest procedure. So we were selected and approved by the chief medical officer of an international aesthetic device
again
brand.
Back to those accolades.
Yeah,
See,
it's very exciting.
They picked you for a reason.
Very excited about this. And so we are the first and only med spa that is not owned by a plastic surgeon in the entire state of Kentucky, and I believe Indiana, Ohio, and Tennessee. to have this device and to have been approved. It is some journal articles or literature will refer to it as a surgical device, and some will say it's a non-surgical device. It really crosses, it's a very, very thin line between the two, but essentially we are able to produce results, if we are talking about the face, up to 60% of the results of a surgical facelift using this device, including liposuction. So we can actually remove the fat, like we talked about earlier, deposit it elsewhere if we want to. But the transformations are incredible. It tightens the skin, as well as doing some lipolysis, which is some fat cell destruction. We can do that anywhere. We can do it on the back of your arms. We can do it on your bra rolls. We can do it on, huge, great results on double chins. You can do a little bit of here in the jowling area, so you can tighten up along that neckline. We can do underneath the eyes. We can do your abdomen. We did a set of inner and outer thighs last night that were exhausting. Hannah and I did it together,
So
and
the breathing.
we were
This
so
is the breathing.
tired. But we got so much really great, beautiful, rich fat out of those fat pockets that had just settled over time.
Wow.
And that is just really gratifying. It's gratifying because, one, you can actually hear the adipocytes, the fat cells membrane rupture when they get heated to a certain temperature.
This is medical people love this.
Yeah.
We're both
It's
like,
it's
ew.
our version of pimple
Nerding
popping.
out
She's like,
right
it was
now.
so
Yeah,
good. We're like,
it's our version of pimple popping. It is awesome. So you can actually hear it rupturing, which is really exciting. But you have the instant transformation of the fat pocket being reduced. The skin contraction happens over time because that's a heat-mediated reaction, and any kind of heat-mediated reaction takes time. But the results are
they're instant
truly
too.
awesome. Yeah, I mean,
Wow.
we're delivering. We were doing non-surgical facelifts before this using threads,
Right.
which had great results. You leave out of here. People were flying in from all over for those procedures. You leave out of here with your result, but that lasts about a year. Then you can pay the same cost, and you can have something that's going to last for significantly longer, but isn't going to give you immediate results. So we have a lot of tools in our toolbox, which is really cool, I
Yeah.
think,
Yeah,
to be able to
absolutely.
utilize to help people feel their best.
What's the definition of surgery, by the way?
I think
Is it just cutting of any sort?
I think it's anytime you have like an incision. Now, you can have, you can do like uroscopies, or hysteroscopies, where you don't really have an incision. You're just putting someone to sleep for the method of, for the purpose of being able to explore comfortably for a patient.
Because the only reason I ask is
Yeah.
because you say there's this weird, it's surgical, non-surgical. So
Yeah. We are
what's the
making-
definition between both of them?
Yeah,
How do
so we
know?
are making incisions occasionally. We do make what we call pilot holes, which is just an area that allows us to pass cannulas through. Most of the time, those don't need sutures. When I think surgery, I think someone needs stitches. That's a very generic way to put it, but so we can put stitches. Yeah. Surgery tends to have more downtime, especially if you're doing it under general
That's a good
anesthesia.
point. Yeah.
Yeah, and we do everything under what we call monitored anesthetic here, a MAC anesthesia here. So it's all conscious sedation, meaning you don't necessarily lose consciousness during your procedure. Now, if we need to, we can do that as well, but especially for those particularly squirrely patients. But it's not ideal. We're not going to necessarily offer that for everybody, but we can get patients very, very comfortable, and to the point where they walk out of here, and we had it this week, they left and they said, I don't remember a thing. And that's great, because they were able to converse with us the whole time. They were able to hold positions that we needed them to hold. They were perfectly comfortable, and then they left here and they didn't remember a thing. So that's ideal, truly. They didn't need a breathing tube. They had a driver. They went home. They rested the rest of the day. So that's ideal. So, I guess if you're thinking about it in terms of that, it is kind of a surgical procedure. We are making incisions. We are making a change to a patient. We're not doing any kind of implants or anything like that, unless we do like some fat grafting, which would come from their own body. But and then we can do anesthesia for it too, which is really cool.
Yeah. So I guess downtime, like you said.
Yeah,
Pretty
downtime.
much. Yeah.
That's wild.
Yeah, it's pretty mild. Yeah, comparatively, if you're gonna have a facelift, let's say you have a deep plane facelift, you're looking at 8 weeks at least of downtime. At least at minimum. And with anything that we do here, I would say at most we look at a week to 2 weeks.
Oh, wow.
And that's if we're doing some really, really aggressive treatments. Some deep, lasers, deep peels, some really, really deep treatments, you can have a week to 2 weeks of downtime. Even some of the liposuction, you have a lot of swelling from that, so those are but a week to 2 weeks tops, I would say.
I have a different kind of question. So why'd you decide to go with the Scout Guide? New to the market.
Honestly, Jennifer's just really fun. And she caught me on a good day. Actually, we were over. Do you remember? We were over in the other spot, and she brought the Lexington one in, and I just thought it was so beautiful and unique, and not like anything I had ever really seen in the city. So I was really excited, A, to have it in Louisville, but B, that I was being asked to be a part of it. Felt really special. And Jennifer and Lisa have just been really lovely to work with. And so, it was a no-brainer. But, and the photo shoot was really fun. We had a really good time in the photo shoot.
Where'd you do it? Did you do it here?
We did it at Janice's house.
Okay.
Yeah.
Cool.
Yeah, it was a lot of fun. Yeah. It was a good day for all of us. We went out and had mimosas and breakfast afterwards. And it was a good day. Yeah, it was a great day. So it's been really fun. We're excited.
Good.
And again, we did think that, there's reasons we picked you guys to talk to too, because you guys do have there's just a different vibe about what you do, and your backgrounds and how you're growing and all the things. So it was, there's a lot of med spas.
They're popping up on every corner now.
And
truly.
we work with a limited number of them. So, and we're very honored to work with you guys.
Thank you.
Yeah,
We're glad
very
that you
much
chose
so.
us.
Yeah. And I was going to ask you too, because a lot of the skincare that, what makes you decide, like, how do you pick like Skin Better Science? Like what are some of your like levels of like, well, this is what we're going to go with. Criteria. Thank you.
Sure.
That's what I was looking for.
Hannah and Emma bullied me, and I'm just kidding. No, oftentimes, a lot of things.
And I'm sure
are
it
social
changes
media driven.
sometimes.
Of course,
yeah.
And it has changed over the years too.
Sure.
We try to find a really nice balance between affordability for a patient and results. And that can be challenging in medical grade skincare, truly. You can buy a $300 serum from, Estee Lauder, and it's not going to come close to a $150 serum that's medical grade.
Right.
But a lot of people don't know that there's such a difference between over-the-counter, what you can buy at Macy's or Walgreens, and what you can only buy in a provider's office because it's technically prescribed. And so Skin Better has made a lot of really great content lately, and so they are really popular on social media for excellent reason. Their quality standards for their products are absolutely insane. Their quality metrics. Hiring Emma this last summer, she is a huge fan of a very well-known Instagram influencer who does a lot with Skin Better, so talks a lot about the science, and she was really passionate about it. So she was really excited to bring it on, and honestly, I was too. And then Hannah we've looked into color science, and we've loved kind of their philosophy for a long time. Color science is taking makeup and SPF and peptides. So you're literally getting your sunscreen, your makeup, and your skincare in
like
one
a BB
product,
cream kind of on steroids,
which is awesome.
Yeah.
And honestly, that's all I have on right now is color science. Yeah. And I'm pretty sure that's all Hannah put on today too. And so that is really a lot of what we're driving home is like sunscreen. But it allows it in a much more bite size, you know what I'm saying? It makes it more digestible for like, oh wait, okay, so this I can get my makeup in with this too. It reduces the number of steps, which is appealing to anybody, but it's also really affordable.
Yeah.
And then Elastin is wonderful too. Elastin's merged with Galderma in the last year or so. And the Elastin products are really great.
Stuff.
We do have a couple of Neocutis products, which was developed 20 plus years ago for pediatric burn victims. Neocutis quite literally translates to new skin. So it was a skincare line designed to help pediatric burn victims develop new skin after sustaining a burn. And then they realized that they could turn it into skin, because essentially aging is just a controlled wound over time of the skin. And so they realized they could turn it into a global skin brand. It's wonderful as well. It's a little
I like that one that you gave me the
Biogel.
It's like a
Was it
and
the
then
gel?
that one and the tinted one.
Oh, the tinted sunscreen. Yeah.
Yeah, that's a good
Yeah.
one too. Yeah.
Tinted sunscreen is the new foundation.
Yeah,
Honestly, I
yeah.
don't know anybody that even wears foundation anymore.
good.
It's the tinted sunscreen is the new jam. So
But you're right. Like, I think people don't think about the differences of like the drugstore brands and the department store brands, and the
Sephora,
biggest difference of why you should get it from your esthetician because of the medical grade. It's just that you're going to get a better amount of what's going to really do the job it says it's going to do from the one here. Yeah, that's true. I always forget about that being the biggest differentiator.
yeah, absolutely. And the the concentrations of various chemicals that can be sold over the counter. For example, your
Right.
retinols vary what can be sold over the counter versus what can go into a medical grade brand. So you may buy something over the counter that says, it's a 4% retinol, but when you look on the back of the ingredient list, it's actually retinol aldehyde, which has to go through multiple conversions in the body in order to actually turn into usable vitamin A.
So it would take
which is what you
forever.
need. So it not only does it take forever, but every time it goes through conversion process, it drastically reduces the efficacy of it. So you think you're getting this 4% retinol, but in reality, you're getting a 0.01% retinol. That's not really gonna. I mean, it'll do something. It'll do something better than water will, but it's not gonna do what a medical grade will do.
Yeah.
And that's why that has to be prescribed.
And
by a
people do need to
provider.
think about the money you're spending at a department store. You just need to invest in your esthetician's
Truly.
products.
Yeah, truly.
At the end of the day.
Yeah. And there are so many great brands out there. I mean, if we could have them all here, we would.
Right.
We just don't have enough room in our tiny little 1,200 square foot med spa. But there are so many great brands out there. But if, by and large, if you are getting your skincare from a dermatologist, a med spa, from your esthetician, from your injector or nurse practitioner or provider, you're getting something that's going to be quality for your skin.
Yeah. And worth the investment.
Yeah. Well, this has been awesome.
I
Thank you so much for
know.
allowing us to come in and
Yes.
crash your space.
And before we go, please tell everybody kind of where you're located and all of the things. And you need to follow them on TikTok because I think you guys do such a great job on TikTok. People are so afraid of that platform, and you all just ran for
Well,
it.
the funny story is we have one person that does all of our TikTok.
Well, they're
because
good.
I'm terrified of TikTok, and so we have one person that does all of our TikTok, and she has multiple accounts that have 60 plus 70,000 followers on each of them. And we are like just barely struggling along trying to get to 400 and 500 followers. But she has a ball.
Well,
she has a ball
they're
doing
great.
it, and we have a lot of fun with it. So
And I love where you're located. You're in being from Louisville, I love that you're at the Old Vogue Theater
we're in
shops.
the old Vogue Center. For the people that grew up in Louisville, it's where Rocky Horror Picture Show used to be played over here. So I have a lot of history in this area too, but just right in the heart of St. Matthews.
It's a great spot.
At the corner of Shelbyville, Lexington, and Frankfort Avenue.
Well, thank you all for your time. It was so fun.
Thank you.
Yeah, thanks
Yes.
for coming.
Hey, thanks so much for listening to the Lexington Business Show. Go right now, rate and review the podcast. It's how we grow and thrive and how we get more listeners and get to do a lot more cool stuff here on the show. Thank you.